What is the dura? So this is a key structure that we treat here all the time with every patient because it's just so important. And what I usually tell my patients is that the dura is a Ziploc bag that covers the brain and the spinal cord. And it is the superficial layer that covers, that's the superficial layer of that Ziploc bag. And there's three layers to it, but we primarily treat the dura. And I prepared some pictures here. So, ta-da, we got this wonderful picture here of, we got the brain. See if you guys can see it. We got the brain, and we got the spinal cord, and we got the peripheral nerves that come off of it. And that's in blue. And the brain is covered by the Ziploc bag. Is basically the meningeal system, and I have it colored here in orange. And it goes all the way down past the different segments of the spine, all the way down to the tailbone. And how I usually explain to my patients is that this Ziploc bag covers the brain and spinal cord and goes through the various spinal canals, various attachments, that's C2, C3, and S2 of the spine. And it comes out right here at the bottom of the sacrum. Let me grab a model. And here's the model, and here's the sacrum, and here's the coccyx. So it's just like what we have on the board, and like I usually do with my patient. Boop, we pull it out, and there's the sacrum and the coccyx. And this is the coccyx here, also known as tailbone. And the dura comes out of this upside down chevron. It's called the sacrocorneal. It's around S5. And what I tell patients, like someone took a heat gun, melted that dura and turned it into a ligament. And that ligament will go over the tailbone. And that ligament that's going over the tailbone is called filum terminale or filum terminalis. And and that ligament goes underneath the tailbone. And after it goes underneath the tailbone, it goes up. And as soon as it starts to go up, that same ligament changes name to anterior longitudinal ligament of the spine, also known as ALL. And it goes in front of the coccyx, front of the sacrum, front of the lumbar, front of the thoracic, cervical spine, and up into the skull. And as it goes up to the skull, it'll go forward um, over the inside the skull, and it'll branch out like a Japanese fan, and it'll cover the rest of the brain, called the tentorium. Now it's back to that Ziploc bag, and it'll follow the spinal cord back down the whole of the base of the skull, creating that Ziploc bag, following all the way down to the tailbone area and melting into that ligament. And in short, that is the anatomy of the meningeal system. And usually, what I explain to my patients, and we're going to bring George here. George is a very helpful person. Here is George, and what I explain to patients, it's like a conveyor belt, right? So we got the dura going through the spinal canal, going all the way down through the spinal canal, the sacrum to the coccyx, going up the front of the coccyx, becoming the ALL from the coccyx, sacrum, lumbar, thoracic, cervical, etc., etc. And in short, it basically looks like, if I could do it for the, it's like a little conveyor belt. Okay, so some of our patients made some great treatment for the spine, get some great treatment on various parts of bones of the body. But this dura is really key because unless this dura is treated out and facilitated in a healthy way, there's no long-lasting relief in regard for many conditions, to include pain and inflammation. And the key thing here, we got the Ziploc bag that covers brain and spinal cord, and everywhere the spinal cord is at, I'm not sure if you can see it, but anywhere they see the spinal cord, that's where the peripheral nerves start to branch out. Okay, and this is the peripheral nervous system, where everywhere the nerve branches out. And everywhere the nerve branches out, that dura creates like a little sleeve. Okay, that sticks out. And so here, if we go here, on this part of the board, we can see the peripheral nerve in blue, and then we can see that sleeve. This sleeve is called the dural sleeve. And the reason why this is important, and we go back over here. Oh, it's backwards. Anyway, so the reason why this is important is because anytime there's tension of this dura, anytime there's tension on this dura, it's gonna, for example, if there's tension above the spine of the area in question, that dura is gonna get pulled up. Or if there's tension below the area of the spine in question, that dura is gonna get pulled down or dragged down. And anytime that dura gets pulled up or down, or sometimes a various thereof on left or right side, etc., what that does is takes the sleeve of that dura. In this case, we go over here, the sleeve of the dura, and it's going to pull. Like if the dura gets pulled up, it's going to drag that peripheral nerve, and it's going to drag that peripheral nerve in. And the reason why that's important, because when that peripheral nerve is constantly on tension, what happens is at the terminal end of that peripheral nerve, it's gonna create, you're gonna get some inflammation in the area because it's gonna have this strong tension on the terminal end of the soft tissues. And that's going to send a message to the somatic system, and it's going to say, hey, something's wrong here. It's always tight. And then so it's going to start the healing process, an immune response at the local level. And then when it goes on long enough, then the global healing system will start to kick in. And so now you got the whole immune system kicking in, thinking that, hey, there's something wrong in this one spot, and now we need more help. And then the whole body starts to go to inflammatory response. And so sometimes simple things as like tendonitis in the elbow or at the knee or anywhere there's kind of chronic tension or swelling, patellotendinitis, plantar fasciitis, bursitis, etc. thereof. When it goes on long enough, it can trigger an immune response through the whole system. And so, as we know, I think it's common knowledge, or at least I feel like it's common knowledge at this point, is that a lot of the problems that we have in our bodies due to inflammation, right? And so this would be one explanation for the chronic inflammation in our body. And so that's why it's so important to get this dura treated out. Now I want to go. Well, I call it dura, but it is the entire meningeal system. And so we're gonna go further from this peripheral nerve to dural sleeve, and just a little fun facts here. So I have drawn here. Ooh, it's backwards. I'll fix it next time. Uh, but this orange here, if we take a microscope and we zoomed in to this orange line here, we zoomed in, we would look at this. Maybe that's something that we see in our microscope. And so this is the outside and this is the inside. The blue is the nerve or brain or spinal cord, any anatomy of the nervous system, whether peripheral nerve or central nervous system, respectively. And so when we're looking at the meningeal system, we have three different layers. I know it's backwards, I'm so sorry, but it'll be fixed next time. So this one's called the dura mater, is the superficial layer. The middle layer is called arachnomater. It's got all these swirls in it for the fluid flow. It's called pia mater. Okay, so dura mater in Latin is tougher. Okay, we got arachnomater, and the pia mater on the inside is called soft mater. So when I say dura mater, when we're treating the dura, I'm referring to dura mater. I should have started with a fun fact my wife was mentioning, that everyone can relate to. If anyone who's got epidurals, when they say epidural, they're talking about inserting a needle into the superficial layer epi of the dura mater. Okay, so that's the epidural. And then a lot of times when they do epidural for the low back, they're going to insert that needle through the skin and many layers of muscles and tissues to get to that dural layer. And that dural layer is called tough mother, right? In Latin for tough mother, and it's very thick. It's like almost like a piece of plastic. And when that needle punches through that piece of plastic, it's like boop. It kind of punches like a pressure goes in, and then not punching all the way through into the cerebrospinal fluid, but just at that very thin layer of the dura, the needle will sit there, and then they'll inject the pharmaceutical medication to create what's called the epidural to hopefully abate the low back pain in the area. So, so that is the duro mater. How do you turn this thing off?